States are starting to tighten restrictions again in a bid to slow the movement of the Omicron strain as COVID cases soar across the country. Dr. Anita Munoz, the Victorian Chair of the Royal Australian College of General Practitioners, joins me now. Good afternoon to you, Doctor.
Good afternoon.
Firstly, the vaccination of children is due to commence on January 10, that is on Monday. Are GPs prepared? Do they have enough doses ready to go?
Sadly, we don't have enough doses at this time. Some of the doses that we've been receiving across Victoria certainly are only in the hundreds. Most practices have received only 100 per week. So that's definitely going to fall short of what the requirements are in the community.
In that case then, a doctor's being forced to postpone bookings, cancel bookings, sort of put people on hold until, there's enough supply?
Yeah, we do know from the experience of last year where we had the logistical challenge of having to cancel fully booked vaccine clinics because doses didn't arrive. Most GPs and also pharmacies are not willing to book people until the doses are actually safely in the fridge. So that is slowing things down. I also think it's very frustrating for parents who are very keen to get their kids vaccinated. I think what that means is people have heard our message about the need to vaccinate and they're prepared to vaccinate their kids, which is absolutely wonderful. But unfortunately, the system is the slowest moving part now, and it's very disappointing to call up for a vaccine and not be able to get one.
I was speaking to a representative from the Nurses and Midwives Association a little earlier this afternoon, and she was saying that she feels like there's a real disconnect between what's happening on the ground in our GPs, our clinics, our hospitals, and what the, say, government modelling is showing us. Do you feel that's the case?
I think we've been calling from the very beginning for there to be clearer communication between funders and decision makers and our sector, which is community care and primary care. We're really hopeful that as the people that have to roll out this vaccine program and the people that are actually delivering the service, that we know ahead of time what the changes in policy is going to be so we can prepare ourselves. Unfortunately, we continue to be alerted about really important changes at the same time as the public, and it doesn't give us much time to pivot so that we are ready for the change in policy or new demand from the public. So I think we still have a lot of work to do on the communication between decision makers and the people that are actually on the front line, upon whom the whole success of the program rests.
You've got the paediatric rollout, you've got the booster jabs also taking place at the moment, you have soaring case numbers, you have rapid antigen tests are the most in-demand pieces of equipment in the country at the moment. What is of most concern to you in Victoria right now?
Look, I think that from the point of view of policy and decision makers, perhaps there's not quite the understanding that I think we need of the huge pressure that's being applied to our sector. So as you've rightly said, general practice and community pharmacy and community health centres are trying to do a gargantuan task of adult booster programs, start and complete the childhood vaccination program. We're still trying to manage COVID positive patients in the community, of which there are now thousands. But we also need to ensure that we're doing business as usual consulting so people can manage their health. That is an absolute unprecedented stretch on our sector, and I think it would be really helpful for that degree of pressure to be understood so that we can better resource general practice and resource pharmacy and community so that we can cope with what we're being asked to do.
Just before I let you go, Doctor, how are you finding your colleagues? How are they coping?
Look, I think we are all exhausted. This feels like it's an interminable reality now, and morale it is low. We want to be able to vaccinate. We want to do what we do best. We want to see our patients. We want to be able to keep our clinics open. But we really do need more support to do that than what we've got currently, because as we've just discussed, general practice is trying to be in so many places at once. We are struggling to be able to do everything that the community is asking of us.
Dr. Anita Munoz, thank you so much for your time this afternoon. We really appreciate the insight.
My pleasure.